Hi, my name is Erika Saucedo. I'm a board-certified ophthalmologist here at Pacific Eye Institute. Dry eyes is a condition that we see really frequently here in the Inland Empire. Most patients have dry eye, it's just a question of whether they realize it or not. Symptoms of dry eye include foreign body sensation, redness, tearing. Believe it or not, when eyes water, that actually can be a sign that the eyes are dry because it's a reflex tear. Think of it like when your eye gets an eyelash in your eye and then it tries to wash it out. The brain doesn't realize that it's just dry and it's actually trying to wash that out. Other thing that patients will tell me is that their vision becomes clear, and then after they blink, and then after a few moments the vision actually gets blurry, they have to blink again. So that too is a sign of dryness. Treatment for dry eye is typically started with artificial tears, moisturizing the eye, so you can use artificial tears throughout the day. I usually tell patients anywhere from 1 to 4 times a day. Other things that we sometimes use is maybe ointment at night. That's obviously something thicker. Think of that like when at night we use a heavy moisturizer to moisturize our skin. Same principle, we're moisturizing the eyes at night. Does tend to make the vision blurry. That's why we have you do that right before you go to bed. If those things are being done and a patient still is having dry eyes, then we move on to things like punctal plugs. Sounds scary, but basically it's these temporary plugs that we place in the drainage system of the eye. I think of it like a bathtub. So if you were to put a plug in a bathtub, that's going to keep the water in the tub. Same principle for the eyes. That's going to keep the tears in the eyes so that maybe you won't have to use your artificial tears as often. The other things that we can do are prescription eye drops. Typically the prescription eye drops decrease inflammation because dry eye is thought to be an inflammatory disease.